There are several different types of blood cancer, and while some can be curable, others, like multiple myeloma, are not.
September is Blood Cancer Awareness Month, and joining us now to discuss multiple myeloma and the advances being made is Dr. Kenneth Shain. Thank you for joining us, Dr. Shain.
Thank you, Ebony and Sasha.
Okay, first off, what is multiple myeloma?
So multiple myeloma is, as you said, it's a blood cancer. It's a rare disorder of the bone marrow, within the bone marrow of our bodies. It's one that's very complicated, so it's one we need to understand pretty well and raise awareness to, because unfortunately today it still is an incurable disease. So we're making great strides to cure, or at least control disease for long periods of time. But it's a disease that we know has that causes lots of symptoms, and that's kind of defining events in that disease. So it's critical for us to, again, identify good therapies that can control disease for long periods of time and provide our patients maximal ability to live while having this disease under control.
How has the treatment of multiple myeloma changed over the past decade?
So I think it's a really exciting time for patients with myeloma and researchers with myeloma, because a lot of the success that's coming from our research has allowed us to develop new therapies that allow us to control disease with greater levels of success, meaning longer term control. One of the things we have with our patients is they're stuck in this pattern of successful therapy and the relapse. And the more therapies we have, the more we can continue to treat patients and keep the disease under control over time. And that's really what the last decade and last 18 months have really taught us, is that we're moving in that direction. We have lots of new therapies and options, but we need to continue to strive to get more and more drugs available for these patients.
And tell us, what has helped contribute to the advances in multiple myeloma treatment over the past decade?
I think central to all of this advancement is really research. Research is central to all this, understanding what the myeloma cell needs to survive, how it survives and proliferates and becomes resistant to the therapies that we have now. And better understanding of that has allowed us to translate into new targeted therapies, targeting aspects of the biology of the disease itself. And then obviously participation with our patients and our caregivers in clinical trials, translating those new developments into new therapies we can use for everybody.
As a physician, how do you decide what treatment a patient should receive?
Obviously, this is the most critical part for everybody, is the patient sitting across from me. What we have to recognize is every patient is their own unique disease. I know they all have myeloma, but every patient has their own. And so we need to take into account a lot of different aspects of the disease itself, some markers within the disease, as well as the patient, and make the decision about what therapies are going to be right for that patient at that time, hoping to personalize the therapy to some extent.
All important information. Where can viewers go to learn more about multiple myeloma?
An educated patient is really critical to all of this. And so what a lot of great resources put together is ways for our patients to get information from the internet. And so the Myeloma Research Foundation, or MMRF, the International Myeloma Foundation, IMF, or the Leukemia and Lymphoma Society are great places to go to get important, vetted, high quality information, as well as other resources about myeloma, as well as other blood cancers.
Dr. Kenneth Shain, great information. Thank you so much for joining us here on Coffee with America. Hope to have you back.
Thank you very much for your time.